Hi, I'm Neil O'Grady, osteopath, and my mission today is to teach you the brachial plexus. The brachial plexus is a network of nerves that leaves the lower neck and it feeds the entire shoulder girdle and arm. It would travel from the lower neck underneath your clavicle or your collarbone over your first and second rib, and it would feed some of the muscles in the shoulder and the entire arm in both cutaneous and motor supply. So that's sensory and motor movement. The brachial plexus is sometimes something that is confusing first time out when you're learning it, but I'm going to try to make it pretty simple. So I'm going to try and draw it in a structured manner in grids so you can reproduce it and thereby have a mental image in your head of what the brachial plexus looks like. You can apply this then to clinical practice. So if you're a physio or an osteopath or a chiropractor or an orthopedic sports therapist or whatever you are, or something in healthcare, or you can apply it to an exam scenario if you're studying it. Okay, so let's have a look. So I'm going to start here on the left of the board, and what we've got here is the vertebrae in your neck where the brachial plexus would leave. So C4, C5, C6, C7, T1, T2. To make it structured so we can reproduce it, I'm going to draw 4 dotted lines down the board to break it up into logical sequences of when things happen during the course of your brachial plexus, traveling from the left of the board to the right. Okay, that's from your neck out to your arm, we'll say. So 2, 3, 4, 5, 6. So we go 4 of these guys down like that. 2, 3, 4, 5, 6 across, and we'll again second one of these guys here. 3, 4, 6. Okay, and one last one. Okay, so that's what we've got so far, alright? Now, the brachial plexus, to begin, I'm going to give you what's called an acronymic sentence, and it goes like this: remember to drink cold beer. So that's the first thing I want you to remember. Remember to drink cold beer. Okay, so how it goes is R, okay, is for roots. Remember 2 is for trunks. Trunks. To drink is divisions, okay? Divisions. Cold is for chords. And beer, B, is for branches, okay, or your terminal branches. So far so good. Okay, and the next thing I want you to remember is an acronym, and it goes like this: MARMU. Okay, so that's over here. So M is for, so we go M, right? And we go A, R, M, and U, okay? The M up here is for musculocutaneous, okay? The A is for axillary. The R is for radial. The M is for median. And the U is for ulnar, okay? Those are your terminal branches. Alright, so how do we get from the neck all the way over to your terminal branches? So, the nerve roots leave between the vertebrae, and the way it goes in the cervical spine, which is a little different than the thoracic and lumbar spine, is that the nerve root exits the vertebrae below it. So C5 nerve root will leave between C4 and 5, i.e. above C5. Okay, so C5 here. Okay, C6 will leave here. C7 here. This is where it gets a small bit weird. You've got a C8 nerve root between C7 and T1, even though there is no C8 vertebrae. And then the rule changes and it remains the same for the rest of the spine, where it goes T1 here. So the nerve from T1 down leaves below the named vertebrae. So the T1 nerve root will leave below T1. The T2 nerve root will leave below T2, and so on. Okay? So what happens here? C5 nerve root leaves between C4 and 5 out here. Okay? And C6 comes out between C5 and 6, and they join into a common root across here. The C7 comes straight out, okay? And the C8 between C7 and T1 comes out here, and the T1 comes out here, and they join to form a single root. So what we're going to do is we're going to continue all of these roots onto the fourth dotted line, okay? So this root will continue on into its own trunk all the way along here, like that. The C7 will continue all the way along here to the end here, like that. The C8 and T1 will carry on all the way across to here. Alright, so this is what we've got so far. So those are your roots. These are your trunks. The trunks will be called actually upper, middle and lower, which is, okay, so you've got upper, middle and lower. And I've also seen them called superior, middle and inferior. Both are acceptable. Here, divisions is what happens at the divisions is the nerves, the roots and trunks interconnect so that they're all connected in the cords and branches. So there's interconnections between all the nerves. And what will happen is there will be an anterior portion, a posterior portion and an anterior portion. So the upper trunk and the lower trunk will remain anterior, and the middle trunk will be posterior. And anything that joins in here will be posterior, and anything that joins to the upper and lower will remain anterior to the front, okay? So A equals anterior, P equals posterior. Okay, P equals posterior. So what you've got here is you've got anterior, right? And then this upper trunk comes down here like that into this posterior cord over here. And this middle trunk comes up like this and joins into this upper trunk like that. So this then is anterior, this is posterior, this one here then is anterior, this one here, because it carries on there, posterior. And then we've got the lower trunk coming up off here and joining in, and they'll all join in here like that. And this one will be then posterior, and the bottom one will continue anterior. Okay, so that's your anterior and posterior divisions. Next, you've got your cords. You've got your lateral, your medial, your lateral, your medial, and your... So this is your lateral cord here. Lateral, posterior cord, okay? And your medial cord. Lateral, posterior, medial. And what does that mean? What is it lateral and posterior to? Lateral, posterior, medial is in relation to the axillary artery, or specifically the second part of the axillary artery. Okay, so lateral, posterior, medial. That's what the cords, that's what it relates to. Now, how do the cords break up into the branches, the terminal branches? All right, so So the lateral cord comes over here into the marmu, musculocutaneous nerve. Okay, and then you've got the axillary here. Okay, the radial, and the posterior cord. What happens here is it would break up like that, into the axillary and radial, and then you've got this cord here, the lateral cord, coming all the way down here like that, okay, and the medial cord coming all the way up like that, and that forms your median nerve, okay, your median branch, and the medial branch here continues on to your ulnar branch. Okay, and this one here is in behind, so what we'll do is we'll draw like that and like that, and that's your terminal branches. So this is taking us all the way across from your neck all the way across to your terminal branches. Now, what was never explained to me when I first learned this, and to a lot of people, and I don't see it spoken about, is where is all of this stuff in your actual neck or in your body? So where are the roots? The roots are in the lower to middle portion of your neck. So the roots are actually where they are on the left here. So the neck, okay? The roots are in the neck. Okay, the trunks are in the lower neck, just above the clavicle, okay? Lower neck. The divisions are at your clavicle, okay? Clavicle. The cords are below your clavicle. And the branches are in your axillary area, so your armpit region, in your axilla, in here. So it's just nice to know where they actually are located on the body. Now, I'll use a different colour pen here. So what we're going to do now is we're going to go back to the beginning, and we're going to look at all the different nerves that branch off the brachial plexus from the point where it leaves the neck, the lower neck, across to where it gets to its terminal branches. I won't include the ones that come off the terminal branches, and there are lots. That's going to be in part 2 of the brachial plexus, where I'll draw this portion here coming off the edge of the board, and I'll talk about all the cutaneous and motor branches that come off the marmu, musculocutaneous, axillary, radial, median and ulnar nerve. But this is enough for now, okay? So we'll keep it into 20-minute blocks. So let's get a nice green pen, and we'll start drawing all the nerves that come off this. Okay, so what have we got here? We've got a special one that comes off here, and this one it comes off and it goes to the phrenic nerve, right? That's nerve. And what does the phrenic nerve innervate? The phrenic nerve actually innervates your diaphragm. So your diaphragm is like a dome-shaped muscle that is underneath your lungs. It has attachment points on the underside of your ribs, the margin, the costal margin here, like that. And it has a central tendon that joins to your lumbar spine. So what happens when you take a deep inspiration or breathe in deeply? The central tendon will pull the diaphragm down and the dome will flatten. And when you breathe out, the dome will rise. Okay, so it's important for that purpose. Next here, you've got one called the dorsal scapular nerve. The dorsal scapular nerve, and the dorsal scapular nerve will feed your rhomboids, minor and major, minor on top and major on bottom, and a muscle called the levator scapula. So the rhomboids are the muscles that come off your spine here between your shoulder blades, They come off the spinous processes and they attach to the medial border of your scapula, and their primary role is retraction of the scapula. So if you see a person who's rounded shoulders, normally their rhomboids are inhibited, or they may have an upper cross syndrome where the chest is rolled in. Rhomboids may be weak, so the rhomboids pull the shoulder blades together like you're squeezing together. And the levator scapula is involved in different roles, but its primary role is elevation of the scapula. It attaches from the medial superior border of the scapula onto the transverse processes in your C-spine, and it elevates the scapula. Okay, so levator scapula. And next you've got one called the long thoracic nerve. This comes off C5, and it's an interesting one because it takes a number of, it comes up here, picks up a branch off C6 and picks up a branch off C7 as well. So it comes all the way down, and where it would be in the human body is it will come down here. You can see it coming down, or it will come down the side of your thoracic cavity here like that, and it will innervate the serratus anterior. The serratus anterior you can see in somebody who's lean or well developed. They're the serrated type muscles on the side, and their primary job is that they protract the shoulder. They attach from the medial border of the anterior side of the scapula and wrap around like fingers onto your rib cage, so they protract the scapula in a kind of a punching movement, okay, or a pushing movement. So this is the long thoracic nerve, okay? That's the long thoracic nerve. Okay, and you've got one down here. First intercostal. And the intercostals are the little muscles between the ribs, and the first intercostal is up high. So they're the ones that contract and relax to squeeze your ribs and relax your ribs. Okay, so the first intercostal nerve. Okay, so moving on then to the trunks. Now we've got one up here called the suprascapular nerve. Okay, comes off here. Suprascap nerve. Okay, and the suprascapular nerve, you guessed it, the supraspinatus and the infraspinatus. Okay, and the supraspinatus and infraspinatus are the muscles, part of your rotator cuff, your sits muscles. They're the ones in the posterior aspect of your shoulder blade. And what they would do is the supraspinatus is involved in the first 30 degrees of abduction or abduction of your shoulder, also a little bit of lateral rotation, and your infraspinatus is primarily involved in lateral rotation of the shoulder. Okay, so then you've got your divisions. You've got no branches really coming off the divisions. And you can move all the way over here to the cords, and you've got a bunch of stuff coming off the cords. So up here like that, you've got your lateral pectoral nerve. Lateral pec nerve. Okay, lateral pectoral nerve. And the lateral pectoral nerve innervates your pectoralis major. And the job of your pectoralis major is to horizontally adduct the shoulder. It's involved in pressing motions like a bench press or a push-up or anything that's bringing the arms closer together. It's also involved in a little bit of flexion of the shoulder joint and a little bit of extension, the upper and lower fibers. So that is your lateral pectoral nerve. Up here we've got three coming off this, okay? So we've got the upper subscapular nerve, upper subscapular nerve, okay? And the upper subscapular nerve feeds the subscapularis. And the subscapularis is the muscle on the anterior side of the shoulder blade, so the front side of your shoulder blade, and its primary job is internal rotation of the shoulder, okay? Because of its attachment points, it attaches on the underside of the scapula and it comes out here onto the bicipital groove, and when it tightens, it does this. Okay. For the subscapular nerve, our next one is the thoracodorsal nerve. Dorsal nerve, and the thoracodorsal nerve innervates the latissimus dorsi. And latissimus dorsi is an interesting one. It has lots of functions, but it's involved in pulling down. It's involved in a little bit of shoulder extension. It's involved in a little bit of medial rotation. So that innervates your latissimus dorsi, as I said. And the lower one here is called this one here is called the lower subscapular nerve. Okay. Subscapular nerve, okay, and the lower subscapular nerve innervates the lower subscapularis, okay, but it also innervates a little one called the teres major. The teres major is often referred to as the last little helper. It's just beneath the latissimus dorsi, and or just above the latissimus dorsi's attachment, and what it does, it does the same functions as latissimus, but it's obviously a less powerful muscle, okay. Now jumping down here, we've got again 3 more coming off these. So we've got the medial pectoral here, okay. Medial pectoral. Okay, and the medial pectoral nerve innervates both the pectoralis major, which we've already spoken about up here. The lateral pectoral nerve also feeds that, and it feeds the pectoralis minor. The pectoralis minor is behind the pectoralis major, which is here. Behind that, and you've got this muscle that goes from the coracoid process. The coracoid process is a little bony finger protrusion that sticks forward off the anterior side of your scapula, and it comes down in 3 strings like a crow's foot onto your 3rd, 4th, and 5th rib. And what it does broadly when it contracts is it protracts the shoulder blade, or it abducts the scapulothoracic joint at the back, which is not a true joint, but it's where the scapula meets the thoracic cavity. So protracts the shoulder and brings it forward. That's its primary role. Then here you've got your medial, your next one, medial brachial cutaneous for short, medial brachiocutaneous nerve here. The medial brachial cutaneous, it's in the name cutaneous, so it's a sensory branch and it's sensory nerve, so it doesn't provide motor function, but it provides sensation. And the medial brachial cutaneous provides sensation to the medial posterior aspect of the triceps muscle back here. So in here, the medial posterior aspect of the arm here, like that. That's what that supplies. And then the last one here is your medial brachial and medial antebrachial cutaneous. Okay, sorry, medial antebrachial cutaneous. So the medial antebrachial cutaneous nerve is also cutaneous, or a sensory nerve, and it only has sensation. It doesn't provide motor function. And what it does, it feeds just higher up the medial portion of your bicep, and it travels down and giving sensory or cutaneous innervation to the medial aspect of your forearm. Okay, and then what they do then is we go into our branches, or our terminal branches. And then we're down past into the axilla, and then the marmu, musculocutaneous axillary radial median and ulnar nerve, will feed everything here. So there's a lot of sensory, a lot of cutaneous branches, and a lot of motor branches of those. So what I'll do is I'll do a part 2. So I'll link that at the end of the video, and you can skip into that, take a break and watch it. And that, in those 2 videos, it should sum up the brachial plexus, allow you to reproduce a drawing of it like this, and have a mental image or a picture of it in your mind. So if you like the video and you like the content and you want me to do content and anything else, please let me know. Just write it in the comments. Thanks very much for watching, and I'll talk to you next time.